Dana, it's great to be here in person in a studio here at the University of Maryland School of Nursing today. I haven't seen some people on campus because we've just been really busy lately with all sorts of things, but now there's a lot of events going on campus. But doesn't it bring you back a little bit from the days of the pandemic when you were like in your little hole or cave and then you see someone and you're like, oh my God, there's life out there.
Right. There's people. Yeah, it's nice to be on campus. It's nice to see people again in person. And we are starting to host a lot of our UMB events and things, if not in person, at least with a hybrid component. So we'll be talking to Dean Yolanda Ogbolu, and we'll be hitting on that social isolation, not just us personally in our work environments, but here in the city and how that affects people, not only in terms of communicating and connecting with people, but it affects their health as well.
Absolutely. So you're going to hear a lot about cardiovascular health and social isolation and things that you might not think about, right? Violence around a neighborhood, or it could be not having access to fresh foods, like being in a food desert, and how that impacts your cardiovascular health as well.
Right. And we've been trying to catch up with the dean for a many number of months now. And it's fantastic because not only are we going to share about something called the RICH Collaborative today, but we're also going to talk to her about what it's like to be a dean in a big university, especially in a town that she grew up in and in a university where she studied. So let's hop on over and get her on screen with us.
Here we go.
You're listening to the heartbeat of the University of Maryland, Baltimore, the UMB Pulse.
So, Dean, it is so nice to have you on the program today. We appreciate you allowing us to come into your beautiful studio space. We are happy to be here and learning the ropes. But we're most happy to be here because we've been trying to catch up with you for about a year now. I think when I first sent you an email about being on the program, the whole goal was to talk about the RICH Collaborative, which we absolutely want to talk about in here shortly. But tell us about what's been going on with you professionally, your climb, your trajectory, and how does it feel to be called dean?
Yes, so I'm really excited, as always, both things to be in Baltimore, and more importantly, to be at University of Maryland in Baltimore, a place that I love, and to be able to lead a top 10 nursing school, one of the largest nursing schools in the country. And so it's really an exciting time. You know, I've been thinking a lot about Davis Satcher, who was the first African-American Surgeon General for the United States. And he said something really simple. He said, I never thought I could, but I never thought I couldn't. And I think it's just really important that I've been able to kind of keep my eyes open in terms of living a life that's full of opportunity and really just going after that opportunity. And so, my trajectory in my mind was not expected to become the dean of the School of Nursing. I've had a great nursing career, 35 years in nursing, and I worked taking care of premature babies in the neonatal intensive care unit for 25 years, and that was a lot of fun. I enjoyed that, but because of my interest in health disparities and trying to understand better why babies of color ended up in the NICU more than other babies, it really sent me on a different trajectory towards academia to be able to engage in research and community engagement. So it's a great place to be, and I'm excited to be Dean Ogbolu and follow the legacy of 134 years of great nursing education here at University of Maryland, Baltimore.
That's wonderful. And your degrees are all from the University of Maryland, Baltimore?
Yes. I am the first alum to become dean of the School of Nursing, and I'm a graduate of the bachelor's, master's, and PhD programs here at the university. And so, I think that's a good story to tell, right? Because it really talks about how open the university is to opportunity and to growth within the university. And so, it's pretty amazing. And I'm happy to have received my education and to be able to continue my career here.
That's a fantastic long story, and we are thankful that you are here because you bring such a historical perspective to the position.
Yes.
Absolutely. And last year during our first ever faculty convocation, you gave a great speech, and we learned a lot about you and how you grew up in the city, not too far from campus, right?
Sure.
So what kind of impression did growing up in the city make on a little Yolanda?
Sure, yeah. I mean, I was really fortunate to grow up just 2 blocks from here, across from Martin Luther King Boulevard, in a place called Lexington Terrace. There were high-rise projects that were there many years ago, and my family and I lived there, and I went to school around here, and I walked this neighborhood, right? And it's just so interesting to be here at this time and to see how much the neighborhood has changed. But, walking through the neighborhood and being able to walk from here to my favorite place, which many of people have heard me talk about, is the Enoch Pratt Free Library on Cathedral Street. Those are fond memories for me. I loved being able to walk up and down, and I said in that talk something that I feel really strongly about, which is Baltimore is a beautiful place to be, despite its challenges and everything. It's a beautiful place to be. And the power of Baltimore is really in its people, right? And the social connections that we make with one another, with our friends and our neighbors, and even with our family. So my grandmother told me as she was working at University of Maryland Medical Center that she could hear my name being called in the medical center. She said, "I hear them calling you, Dr. Yolanda, overhead." And those are strong family connections with your grandparents that told you there's opportunity in the future, and they can hear it and they could see it even before you can. And so it's just been wonderful to grow up in this community.
Sorry.
Go ahead.
I was just going to say that's an incredible story, and it must be so meaningful to you, but also to your family, to have watched you grow up and to stay within Baltimore to give back to this community.
Absolutely. My family's been in Baltimore for 8 generations.
Oh, wow.
And we have a large family. So I have 250 living family members that live in Baltimore.
Oh, my goodness.
When you look at the census, it says 40 to 60% of people in Baltimore never leave. That's my family. And so it's been really exciting to be here. I currently don't live in the city, but I have lots of family that live in the city, and I often tell my students, those people you're caring for, they might be my family. Right?
Do a good job.
It's really important that you understand their needs and that you try to meet their needs.
Well, one of the things you walk the audience through, and we'll talk a lot about this today, is how there are certain aspects of city life, and it's not unique to Baltimore, where things happen that impact you that's more than just your mental health, that could lead to social isolation. And you really need to rely on your neighbors and the good of the people around you to support you to get through that. So walk us through that a little bit. Explain to our listeners and our viewers now what that concept is about social isolation in terms of how you described it impacting health.
Sure. Yeah, social isolation is because of my walks to the library, right? That really triggered my interest in social isolation. And social isolation is a household word now because of the pandemic. But social isolation, it happened way before the pandemic. And so social isolation means that you lack meaningful relationships and connections with one another, with other people. But it's more than just about people. When you live in certain communities, you're also socially isolated from the resources and the experiences that you need every day. Those social factors that you might not be exposed to have impacts on your health. And what I mean by that is, like, do you have a playground to play in that's safe? Right? Do you have places where you can get food? So you can be socially isolated from food and socially isolated from places where you can walk and exercise and keep yourself healthy. And we know that social isolation has implications. It's as dangerous as smoking 15 cigarettes per day.
Oh, wow.
Right? And it increases your risk for heart disease, hypertension, and increases your risk for heart attack. but we also can only imagine the impact that it has on your mental health, right? So it increases stress and anxiety. So in one of my studies that I did recently called Belong to Baltimore, that study really focused on looking at social isolation, looking at mothers of young children. And that was really interesting because I was able to go out and talk to community members and get their perceptions of social isolation. And one father said to me, imagine living on a block where there's 20 houses, 12 of them are vacant. 2 of them are older adults that are bolted behind the doors. And you're afraid to let your children go out and play because the playground's not safe. And he said, yes, I'm isolated. I'm isolated in my house. And so we know that, there are lots of work that needs to be done to really improve the conditions within the city so that people are connected to their neighbors, that they can have a safe playground, they can have a grocery store. And so I've really dedicated my research career to focusing on how to make substantial change in those areas.
Did you notice these patterns as a child or teenager, or did it become more, I guess, solidified in your mind and as you started to go through your education and through your practice?
Yeah, absolutely. So as a child, I witnessed things and I didn't understand it, right? Where I grew up was predominantly African American. And, many people were unemployed. And from my eyes, I could witness the inequities in terms of very close to university. I saw people going to work, but those people didn't look like me. Right. And so, as a child, I noticed the inequities, but I couldn't name it. Right. And so one of the beauties of being at the School of Nursing was I was able to really take courses on social justice, take global health courses, and really understand what that meant and to be able to name it, right? To name it social justice, to understand inequities in wealth, and to be able to understand why things looked the way they did in my neighborhood. Because in the back of my mind, even as a kid, the great thing I had was I was always curious about why. Why is it like that?
Right.
That was the great, and that's a trigger that I think really put me on the path to academia, right? You just keep asking why and researching more and more and why, and then suddenly, why can't we do something about this?
Right.
Now that we understand the why, what's next?
Well, so the Belong to Baltimore program, that would you say that kind of shaped where you moved forward with the RICH Collaborative?
Absolutely, because the Belong to Baltimore study really looked at mental health outcomes. It looked at stress and anxiety as it relates to social isolation, and we learned a lot, right? A surprising finding I just want to share really quickly about that is I also measured hope in that study. And one of the things that I learned was that people that had higher levels of hope were less socially isolated. And I think that's really interesting and something that I'm interested in pursuing more in future research projects. But knowing that people have more risk for hypertension, for heart attack, that was also something really important to examine, and that's what led to the West Baltimore RICH Collaborative in terms of looking at the relationship between hypertension and social isolation, and then really partnering with really great partners.
So this led you to think about the RICH Collaborative. Tell us, well, we've referred to it a couple of times. What does the acronym stand for? And you received, when we first connected last fall, you had just received a tremendous grant to fund that program. So tell us a little bit about that.
So I'm really excited to be leading what's called the West Baltimore RICH Collaborative. And the West Baltimore RICH Collaborative is really focusing on reducing inequities in isolation and cardiovascular health. And so that's what RICH stands for. And it's a collaboration of 14 organizations. So 10 community-based organizations, 2 federally qualified health centers, 2 two medical systems, University of Maryland Medical System and Ascension St. Agnes. And so we have been working together for 5 years. We had that discussion this week and we couldn't believe it, of which only a year and a half of that's been funded.
Wow.
And so that will tell you there's a commitment from both community-based organizations, federally qualified health centers and hospitals, as well as we're partnering with Coppin University School of Nursing, that are really committed to improving the health of people that live in West Baltimore. And we know that hypertension is the most serious issue that's happening in terms of chronic disease in West Baltimore, and that African Americans are at much higher risk for hypertension. And so we've really been working to reduce hypertension through a multi-level intervention. And so the project really focuses on 5 key interventions. So I'll just walk you through them really quickly. Yeah. So one of them is a Health Equity Learning Collaborative. And what does that mean? It means that these 14 organizations are committed to working together, to learning from one another, to really having bi-directional learning from community-based organizations to hospitals to how can we do this better? How can we touch the community better? How can we reach? And so we've learned so much from one another. It's spurred off into other projects. The second thing that we're doing is really addressing social determinants of health through a community health worker model. So we've been able to hire people from West Baltimore, as well as others from across the city, to really come and be engaged and work directly with community members. Community outreach workers are really lay people that can go in and really talk to community members, speak to them in a language that is really easy to understand, and to really engage them to understand what their social needs are. What do they need? Help with finances, help with employment, help with housing, and then identify resources and then reach back out to them and close the loop on those resources. We've also been doing primary and secondary events. What that means is we've been out doing events on how you can reduce your blood pressure. So sometimes we have events at community-based organizations that are our partners, like the Druid Heights CDC or Light Health and Wellness. And sometimes we do it all together, like at Be More Healthy Baltimore at the Convention Center. And we recently had a major event at Roberta's House, which is another one of our programs that focuses on having support groups that can help people that are socially isolated and have experienced violence. In addition to that, we're doing self-measured blood pressure programs because we believe that people at home can help to control their own blood pressure if they're given the resources that they need. So we provide people with blood pressure cuffs, we teach them how to use it, and we give them the parameters to let them know what's too high, what's too low, when you're okay, and when you really need to go out and see your primary care physician. And then one of the things we did that's really exciting is nurse-led clinics. And so part of that proposal was to open up nurse-led clinics. And so we've been able to open up a nurse-led clinic in collaboration with the medical center at McCullough Homes. And that's really exciting, where we have a nurse practitioner in there that is providing care to people that live within a senior facility in Baltimore. And then we've partnered with other nurse-led clinics like the Nurse Health Suite, and the University of Maryland Baltimore has a community engagement center. And within that center, we have a health suite. And we have one of our nurses from the School of Nursing, Dr. Kelly Duran, that manages that clinic on Wednesday. This is a lot of interventions, and I'm sharing a snapshot. I might be missing something, but what I want you to say about it is because it's 14 organizations, there's a lot of power when we can come together. So when we collaborate, we can do more for the community together than any of the organizations can do alone. And so we've been able to address social isolation by doing the support groups as well. So yeah, that's a really exciting proposal that was submitted and funded as this collaboration. And now there's a new opportunity coming for us to resubmit for some additional funding for another 5 years for that project.
That's wonderful.
That's incredible. And that was a $2.4 million grant?
That was a $2.4 million grant. So.
And that was through Pathways to Health Equity?
Yes.
Okay. Wow, that's incredible.
Yeah. And you touched on what some of the organizations do, and obviously, right, as you said, collaboration's key with so many partners, and some of them have their own role. Again, you don't have to go through the entire list, and you shared some of the things that the Community Engagement Center does, for instance, but are there a couple partners who have maybe an interesting role or niche role in this that really complements and brings this all together?
Oh, sure. I mean, I think all of the organizations are contributing in a really special way. I think something that is really special is in the School of Nursing. And in the School of Nursing, we're managing the community outreach worker model, right? And that's been just really interesting. We partner with the Community Engagement Center, for example, with their workforce development program to really try to identify people in Baltimore that would be qualified for those roles. So we're always reaching out and trying to recruit more people into those roles. But the community outreach workers just really bring a special touch to the program. There's, again, the power of the people in Baltimore, right? Bringing in community members as part of our team, and then really giving them the power to go out and impact other people in the community. I really think that's been one of the most exciting parts of the program. And then we have others like Ascension St. Agnes, Total Healthcare, and Chase Braxton that also have mobile units. We have the Governor's Wellmobile in the School of Nursing, but we've been able to leverage those mobile vans, those mobile clinics to go out into the community so that community members don't have to come to us, and we also are willing to go to them.
Yeah.
And so those are other special parts of the program.
You know, what's really amazing is that sometimes there's grants awarded or research that it takes maybe 1, 2, 3 years until you start getting returns and results. And it sounds like you hit the ground running immediately to launch a lot of this. So that's just amazing. So congratulations for getting all of that out on the street so quickly.
Yeah, I think when you talk to community members, what community members will say, stop collecting so much information and let's do something. And this project was really about let's do something, right? And so organizations were willing to partner and take a chance and work together and go out and do something. And so I think it's been really meaningful, and we'll continue to track, the outcomes of the program and hopefully be able to share that to the wider community soon. Sometimes it's hard to make a huge difference in just a year and a half. Our project ends in April 2024. But we'll be able. We do know that we've been able to help link people to resources, to housing, to transportation, and we've given out about 1,000 blood pressure cuffs to individuals. So we know that we're making a difference. We've touched about 3,000 people in the community, and so it's making a difference.
In my marketing role, I actually work with the CEC, the Community Engagement Center, a lot. And it really is incredible to me. When I first came into the university, and you did mention a lot of people who are out doing a lot of things in the community, but right here at UMB, we offer the CEC to the community and all of these programs that are helpful, but we're empowering people. I always try to explain to people who've never heard of it, we're not just handing people fish, we are teaching them to fish. Exactly. And we're helping to provide fishing rods when we can through a grant like this. So it's really powerful, and it's incredible, like you said, not to just talk about it or to inform people, but to really live it and make it work for them. So you mentioned an end date. What do you see? Do you see RICH evolving any during that next year or so?
Sure. Yeah, we have an additional about 6 months left on the project. In the meantime, there's a new call for proposals out, and we're applying for the next phase so that we can continue to expand and strengthen what we're doing in RICH. And we know that to make a difference and to really make a difference in health outcomes, it takes more than a year and a half. And so we're looking forward to the next opportunity, which is a grant for 5 years, and to bringing in more community organizations that will work and join alongside us.
Well, and a shout out to the team who does all of that grant application work, because that's a big lift also.
Yes,
So
absolutely.
so you said that it would probably end, and then just repeat for me the next one if that's granted. That would be
If the next one
5
is
years?
funded, then it will start the day after this one
Okay.
stops, and it would be funded for 5 years,
5
which
years.
is really
Okay.
a substantial time where you would expect to see us really reducing health disparities and cardiovascular outcomes after a 5-year grant. So we've done a lot of great work in terms of building the infrastructure to get 14 organizations to come together, agree to work together, and then put in all the infrastructure needed to make the partnership work has been a major accomplishment. And we're really excited about what we can continue to do in the future.
That's great.
Yeah, absolutely. And just being about a year into this, you've had some short-term success, and obviously you want to collect data to see what the true impacts are. But what can other communities and organizations kind of take away and learn from this model and be inspired to do it in their own community?
Sure, absolutely. One of the challenges I think in healthcare today is there's a lot of fragmentation. There are places where community organizations are working independent from healthcare organizations, independent from academic institutions. And I hope the thread that you see in my work is I believe there's power in connecting. Right. I think that we can do so much more together than any one of us can do alone. And so that connection is so important. And so for this project, what I would dream that people would take away from is really learning how to build the infrastructure so that healthcare organizations and community-based and federally qualified health centers can work together in a safe way, in a meaningful way, and in a way that we all rise together. Because I really think that's what's happening with the West Baltimore RICH Collaborative.
So let's say I'm a listener and my interest is piqued by all of this conversation. How can individuals and organizations support your efforts and the work that's currently being done?
Sure. Well, we're excited. I can tell you, and we have had like an open door. So if organizations come and want to work with us, like I know the American Heart Association, they were really excited about the work we are doing. And so the leader for Maryland came to us and say, I want to be a part of this.
Nice.
And so we were really excited to welcome her in, Rhonda Chapman from the American Heart Association, and she helped us connect to more faith-based organizations. She helped connect us to places where they have a kitchen where they actually teach people how to, do better with healthy foods. And so, we've really had an open door for partnerships and great ideas. Nobody has a monopoly on great ideas. And so when people come and want to share their great ideas with us, we're open and ready to listen. And so they could find us on our webpage,
Okay.
West Baltimore RICH Collaborative.
Okay, and we'll make sure to put all of that in our show notes for people to access it. Charles?
Yeah, I was just wondering, the theme of social isolation and determinants of health, ring through this, and we're seeing the progress. Is there something maybe cooking or simmering beyond the RICH Collaborative that you want to achieve around this topic?
Sure. Well, I mentioned early that the nursing school has a rich 134-year history, right? And in that history, they've always engaged in community health. And that's something that we're really proud about, our community public health program. So today I'm talking to you about the West Baltimore RICH, right? Mm-hmm. But we have programs in the library where our nursing faculty take nursing students to the library, and they help patients to understand the health information that they get from the hospital. And they also address social determinants of health in the library. So they make themselves available several days a week to 4 libraries within Baltimore. And it really emerged because librarians were saying, patients show up in the library, they're discharged from the hospital, and they show the discharge paper, and they ask the librarian, can you tell me what this means? Right? And they don't understand. So having nurses in the library has been really powerful. We've also been in Head Start. And so we're centrally located at Head Starts all over the city. And that's been really helpful because having nurse practitioners there, we've been able to provide hearing exams and health physicals and help children to get to the appropriate places that they need to get care for asthma. And so as a nursing school, we have a big footprint in the community. And then we also are innovative in terms of some of the work we're doing about bringing global and local together. And so trying to look around the world for the best ideas and what might work in our local communities. So we also lead something called the Global Learning for Health Equity Network, which is a partnership with a lot of different organizations from across the country that's really focused on how can we learn the best from around the world and bring it into our local communities so that we can reduce health disparities. So we have a lot going on in the School of Nursing that's really exciting around community health, and I think a lot of people might not know, but we're committed to the community, to Baltimore, to the state of Maryland. We've worked on rural places on the Eastern Shore with our Wellmobile. We routinely go to Prince George's County on a weekly basis where we provide care to a large immigrant population in Prince George's County. So, very dedicated and committed, not only in the city, but across the state of Maryland.
Thank you so much for being on and just enlightening us all and sharing the great work that the whole school is doing, not only in Baltimore, but beyond.
Yes.
So thank you so much for having me. I really appreciate it.
Hey, thank you, Dean.
Bye-bye.
The UMB Pulse with Charles Chalet and Dana Rampolla is a UMB Office of Communications and Public Affairs production. Edited by Charles Chalet, marketing by Dana Rampolla.